Hello, everybody. Welcome to Ask Dr. Bob. This is where you ask me, Dr. Bob Gabe, Chief Scientific and Medical Officer here at the American Diabetes Association, your questions about diabetes. And so this month, for those of you that are joining us for the first time, we pick a theme each month, somewhat based on the calendar, for a variety of different reasons. And we answer your questions. And so we already have a bunch of questions. So let me tell you what our themes are. But before I do that, let me just share with you that uh, beyond this program, you can connect with me on Facebook, LinkedIn, and Twitter for all sorts of other information about diabetes. So, February. What is February? Well, it's two special things, and so we have a twofer here. One, it is Black History Month, and it is also American Heart Month. So we're going to talk about both themes, and we've gotten a number of questions related to each of those. So let me start, and you know, I'll start around the theme of Black History Month, and before I do that, I just want to share, for those of you that may not be aware, the incredible history of Black Americans contributing to the world of diabetes. And I'll just mention like two or three of these incredible individuals, and you can read more about them. Um, First is Dr. Jim Gavin. And Jim was president of the American Diabetes Association. He was president of Morehouse School of Medicine, a real pioneer in thinking about how to deliver better care for people with diabetes. He's done an incredible amount of work. Another former president of the American Diabetes Association is Sam Jack from the University of Tennessee. Also, groundbreaking research, amazing person. Another one I would highlight is Dr. Felicia Hill Briggs has done a great deal of work understanding uh, how how we can do better for African Americans in this country when it comes to diabetes. Has done a lot of the fundamental research in that area. And then Sharita Golden from Johns Hopkins, she's the Chief Diversity Officer. Uh, Both Sam, Felicia, and Sharita have all been board members of the American Diabetes Association. And then a wonderful up and coming person that I've really enjoyed getting to know, Joshua Joseph, an endocrinologist at Ohio State that is doing some wonderful work. So check out some of the things that they're doing. And then finally, I'll say, not only our current CEO, but our previous CEO, both illustrious Black Americans, Chuck Henderson, our current CEO, and Tracy Brown. So, just that as background. So, now let me get to your questions. And so, the first one is, what factors contribute to the higher incidence of diabetes in Black Americans? And so let me start with, what is that higher incidence? And it's pretty disturbing. Um, Black Americans are 50% more likely to develop diabetes than their white counterparts. Um, and their outcomes are significantly worse. Uh, they're twice as likely to die from diabetes and three times as likely to have an amputation, which is really disturbing in an area that ADA is really leaning into to address amputation prevention. So the question that was asked is why? Why is it so much higher in people in the Black American population? And it probably, a large part of it is around, they are more likely to be a lower socioeconomic status, more likely to live in poverty, and we know that both of those things are more likely to lead to development of diabetes and have worse outcomes. Um, and there are likely some systemic barriers that have Black Americans have faced historically that have led to this. And we know that there are clear issues in terms of access to treatment for diabetes, whether that is the right medications or technology like CGM. There are big gaps there that we've documented, and more likely to live in places with food insecurity, food deserts, or what we increasingly see are uh, what we call food swamps, where the food is just there's food available, but it's not great food for people with diabetes. So that's that's a little bit of the why. Um, and so the next question is, how can Black Americans lower their risk for diabetes? And really, this is the same types of things that work for everybody. And the first step I would say for those of you that you or your loved ones might wonder, what is my risk for developing diabetes? If you go to the American Diabetes Association website, and we'll put the link in the video description for the risk test, the ADA risk test. It takes just like a minute. You answer a series of questions, and it'll tell you what your risk of developing diabetes is. So, what can you do if you're at high risk? And for many people, if they are overweight or have obesity, it's around weight management and how can you best manage your weight. And that involves thinking about the kinds of exercises you can do on a regular basis, and thinking about the food that you eat. Less processed food, less sugar, um, are big things to think about. Portion control, not going for seconds and thirds. And again, there's a lot of information on the American Diabetes Association website to help think about those healthy lifestyles. So the next question is, yeah, so what is the American Diabetes Association doing to address this higher incidence of diabetes in Black Americans? And something I'm really proud of is over the last 2 or 3 years, we've taken a concerted effort to lead the effort to reduce health disparities when it comes to diabetes. And with that, we have launched a platform called Health Equity Now, and you can find information in the video description. There's a lot in there about what we're doing. And one of the things I'll call your attention to is really staking our claim for the diabetes community with a health equity bill of rights. There are 10 bill of rights, and they're really getting at this idea that health should be a human right. And so, what do you see in those Bill of Rights? Things like everybody with diabetes should have access to the technology that can help them live healthier. Everybody with diabetes should have access to the foods that can help them live healthier. And so we've been partnering with organizations around the country to operationalize and attack each of these Bill of Rights in different ways. And so stay tuned. We've been doing that from an advocacy perspective. You're probably familiar with the work that we've done that ADA led around capping insulin costs at $35 a month. That's currently for Medicare recipients, and we're working to make that true for all people with diabetes. And we're doing a lot of work around technology, engaging with community partners in a number of efforts. So we're doing a lot to address the health inequities that Black Americans face. Okay, so here's our next question. And again, if you're just joining us, this is Ask Dr. Bob, and we're doing sort of two things this month. Uh, Taking questions around Black History Month, and we'll get to in a moment American Heart Month as well. So the next question is, are Black Americans at higher risk for developing diabetes related complications? And sadly, yes, they are. I mentioned that they are 3 times, let me say that again, 3 times more likely to lose a limb from diabetes, to have an amputation. And that is just a terrible situation that we really have to address. And we've launched the uh, Amputation Prevention Alliance with a number of organizations that we've brought together to try to attack that problem. But also, it's not just amputations. Black Americans are almost 3 times more likely to have kidney failure and require dialysis. So another area where more work needs to be done. Um, so uh, let me segue now into the second topic that we have here this month, and it is American Heart Month. And so, what do we need to know there? Well, the first question somebody asked, which is a great one. It's a very basic one, and I'm glad that they asked. How is diabetes and heart disease related? Well, in a number of ways. So it turns out that if you look at all people with diabetes, the leading cause of death for people with diabetes is cardiovascular disease. And having diabetes significantly increases the risk of heart disease and stroke and peripheral arterial disease. So there's a very tight connection there. Um, so then the question is, are Black Americans also at higher risk of developing cardiovascular disease? Yes, they're at higher risk of developing cardiovascular disease, and with diabetes at higher risk, even more so. Next question is, if you're living with diabetes, what can you do to prevent cardiovascular disease? And you know, one of the themes of this program of Ask Dr. Bob is that there's so much that we can do, that you can do, and that your loved ones can do to lower their risk of problems associated with diabetes. So, what can be done in terms of cardiovascular disease? Well, the simplest way to think of this is ABC. So, what is ABC? A for A1C, which is glucose control, a measure of your glucose level. So, keeping your blood sugar and blood glucose levels in the right range can lower your risk. So, that's the A. B is blood pressure, maintaining a healthy blood pressure. Often that requires medication, uh, but that can dramatically lower the risk of cardiovascular disease. So I said A, B, and what's the C? C is cholesterol. And so lowering your cholesterol and getting it into a healthy range. And again, often that requires medications, and particularly a class of drugs called statins that have been shown for people with diabetes over the age of 40, regardless of their cholesterol, lowers their risk of heart disease. So it's A, B, C. And I'll add one other thing, and that is smoking. If you do smoke, there are lots of resources out there to quit smoking. I know it's not easy, but it is the single biggest thing you can do for your health. And it lowers your risk of heart disease. So lower your risk by the ABCs and smoking cessation. Um, this reminds me of a quick topic I'll just share. Every year the American Diabetes Association publishes standards of care, which are the guidelines that are recognized around the world for clinicians to help their patients manage diabetes. And a couple of new things that are in there that are worth you knowing. And one is the goal for blood pressure is lower now. It is 130 over 80. So you should have your blood pressure less than 130 over 80. So think about where your blood pressure is, know your numbers, maybe be checking your blood pressure at home to make sure you're staying below 130 over 80. And the other big change was about cholesterol and what the goals for LDL cholesterol are. And so, worth you knowing and asking your healthcare professional, what is my LDL cholesterol? Because that's the magic number that really predicts your risk of heart disease. Uh, And if you have diabetes and risk factors for cardiovascular disease, your LDL should be less than 70. It used to be 100, but it is now 70. And your healthcare provider may not even know that because these are brand new recommendations. So tell them, let them know. Have them check the standards of care and see that you're less than 70. And if you have diabetes and cardiovascular disease already, that number should be less than 55. So know your numbers and see where you're at. So, finally, what resources are available for people to prevent cardiovascular disease, for Black Americans, a community to live healthier? And again, this is where I recommend you going to the American Diabetes Association website, diabetes.org. One of the cool things you'll find is at the bottom of the website, you'll see there are community resources. You type in your zip code, and it will tell you a bunch of valuable community resources if you can't afford your medication, if you have transportation problems, housing problems, access to healthy foods. It'll tell you where near you there's a community organization that can help you. So we covered a lot of things today. Uh, Black History Month and the risks associated for Black Americans for diabetes being higher and complications and what you can do. And for American Heart Month, the connection between diabetes and heart disease, uh, the ABCs and what you can do, A1C, blood pressure, cholesterol, quitting smoking if you smoke, and a bunch of great resources for you to connect to. And you can see those resources on the video description. So thank you for joining me. Ask Dr. Bob. I am Dr. Bob Gabe, the Chief Scientific and Medical Officer for the American Diabetes Association. Follow me on LinkedIn, Twitter, Facebook, and thank you for joining and be well.